Hey y'all, I'm gonna briefly go through addiction counseling in diverse populations. I've uploaded the PowerPoints from the chapter in your book, but I also have three additional PowerPoints that I'm going to upload that I just think separate some of these issues and concerns out in a way that's flows a bit nicer and adds a bit more to being able to comprehend what all is included in multicultural counseling and addiction issues. So I'm gonna try and do this briefly, of course, because I try to keep my videos at 15 minutes. Why? Let's see, where do I want to go with this? I think it's important just to first start off by saying, and as you can see on this slide, regardless of the population or the mental health issue you're working in, you absolutely have to be aware of your own cultural values and biases, and your client's perspective and your client's worldview, and what your client is bringing to the session, bringing into the session. It is incredibly inappropriate for us and violating all sorts of ethics if we assume that we know their perspective or we assume we know their worldview, and we use interventions and counsel from our perspective. As we've talked about many times in this course, and as I'm sure you've talked about in other courses, it's their session, it's their trauma, it's their life experiences, not ours. And so we're just there to listen and to hear where they are coming from and to meet them where they are, regardless of your theoretical orientation. When it comes to, I always get these questions of what happens if someone that you're working with does have a belief system or a value system that is different than yours. That's fine. You can believe things that are very different than your clients, but if you impose your own work or your own strategy or your own approach or even your own value or belief system on your clients, that's when we get into problems. And that's when we get into violating their space and their ethics. Make sure that you're doing your own work on who you are and making sure that none of your issues and concerns are bleeding into your clients' issues and concerns, and that you're not imposing a value-based judgment or a moralistic judgment on your clients. If you need to refer out because you may not be the best person to work with that client. But be mindful of referring out, because we can only refer out when someone is better suited based off of scope of practice and area of expertise. So really referring out just because you don't believe that your client's choices or lifestyle is appropriate, that would be unethical on your part. So make sure that you're aware of those, this sort of competence, because it is your duty to do so. So why does it matter in addiction treatment? Why does being culturally aware and competent matter in addiction treatment? Well, there's a variety of different groups and people and ethnicities and races, and you are going to work with all of them. You will not just work with one type of person. As a matter of fact, one type of person doesn't exist. But what we do know is that addiction affects and impacts people very differently, and that race and ethnicity and gender and socioeconomic status and sexual orientation the way that addiction is treated, medicated, as we saw in the medicated assisted treatment lecture, those sorts of things can vary and be different depending upon the individual's race, gender, ethnicity, and then certainly the treatment centers that you may refer to or work in may need to, the individual's race, ethnicity, gender, sexual orientation may need to be considered when looking at treatment centers and approaches. This sort of third bullet point here, substance abuse is not an equal opportunity phenomenon. And really what that means, and surely you guys have already noticed this, that there's not a group of persons or individuals that are immune to addictive use disorders. All people, all individuals, all ethnicity, all races, all age, all genders, all sexual orientation, is affected by addiction equally. Um, and then, of course, we, the providers, we are different. We come from different backgrounds and different ethnicity and different cultures. And we have our own definition of who we are and where we come from. And so when you combine all these differences, it's important that we focus on our clients and that we remember that that's who we're there for. And then, of course, you see this last bullet point here. We are very aware that criminalizing substances, and then also the criminal element or the criminal sort of effect of addictive use disorders is also not limited to just one group or one person or one type of person or one ethnicity, in that we do know that there's a racial and cultural drive, and oftentimes even a political drive behind some of these. We just recently started talking about the issues of race and ethnicity, and we're just now getting into discussing issues of sexual orientation and identity in addictive use disorders. And I'm going to get into that in just a minute. Of incredible importance to the Pembroke population is the focus on Native Americans and then Alaska Natives, of course. There's systemic trauma and systemic oppression that we know that can contribute to the need to self-medicate. That certainly exists in Native American population, and it's one of the things that I've gotten really interested in recently is recognizing the differences that exist in Native American populations and use disorders. So this is incredibly important if you plan to work and stay in the area or in an area that does have a larger American Indian population. Let's see. Here's some considerations here. I encourage you to read up on this specific population if you're interested in it. Each of these populations listed here have their own set of issues and concerns. And then within these different populations, you can see that the drug use can often change. So like, for instance, in Latinos, you may have higher instances of alcohol abuse and so that might look different as you cross different racial and ethnic boundaries. When we look at African American population, we know that socioeconomic status plays a huge role in substance use. We also know that violence and neighborhood and familial trauma plays a huge role in substance use, the type and to the severity. I want to jump really quickly, and I apologize for jumping around a lot, but I want to jump to gender and sex really quickly before I run out of time here. So I have this, again, I'm going to post all this for you, but I would encourage you to look this up. This is the trans education website that you can go to, and you see this little unicorn here. This has actually now been replaced with the elephant, so the gender elephant, and it discusses the concept of sexual orientation and sexual identity. You can see the website here in the bottom, but I would encourage you to take a look at this if you are not familiar with the differences in gender identity, gender expression. What does it mean when someone says you're sex assigned at birth, and then how can someone be physically and emotionally attracted to how that can be different and how that expression is different. I would encourage you to take a look at this website and do some reading, remembering that you are a culturally competent counselor and these are issues that you need to be aware of. So what we need to know about gender and sex. Women have very different reasons, if you will, for use, and oftentimes that can be self-medication, oftentimes that can be as a result of trauma, and depression, of course. oftentimes, especially earlier times when a woman was an addict versus a man being an addict, it was looked at very differently and with much more moral implications or much more negative biases. Um, Again, started recently talking about women and addiction. If you think about that, uh, you know, 29, 29 studies between 1929 and 1970. That's not a whole great deal of time, because we thought that really this was only about men, um, and so that's changing. Um, but we do know that women are equally as affected, but the way that we work with them and treat them may be a little different. So, for example, most treatment centers are separated between men and women. There's men's treatment centers and women's treatment centers. Some treatment centers do offer sort of are co-ed, but usually they're living quarters. If they're inpatient treatment, usually their living quarters are separated. Um, so that's just a little bit of differences in the way that you know different ways of treatment and gender. Also, when working with women, you have to consider issues of pregnancy and is the woman that you're working with pregnant, and then how are you going to at your treatment center? How is the treatment center going to um, treat and take care of also the idea or the fact that she is pregnant, and do you have child care? Will you have child care? What will the individual do once they do have their baby? Do they have to leave treatment? Issues like that are unique concerns for women. So we talked about this a little with in the beginning of our semester, that women metabolize differently. We metabolize alcohol differently, and we can develop cirrhosis quicker. We tend to begin drinking or problematic drinking a little bit later in life, and we can drink smaller quantities and still have equally as problematic effects. Here you can see some health risks that are specific to women that we don't really see in men, or not as great a risk. And then when you think about comorbidity, anxiety, depression, and suicide and suicidal ideations are greater and more likely in women than in men, particularly when it comes to suicide. Women also have to worry about the idea that if they are using while they're pregnant, then you have the effects of use on their fetus and their child, and then of course that may mean that you lose your child. And then this last bullet point here is really important. So some things that make women from seeking treatment is the fact that they don't have anywhere or any place to put their child while they go to treatment. Some treatment options are offering childcare, but those are few and far between. And the inpatient treatment centers where children can come live, I don't even know if they exist. So that may be a huge barrier, and maybe one for your clients if they are looking at treatment. Because certainly they don't want to lose their children, but would like to treatment. We know that women who have substance use disorders are far more likely to have experienced sexual assault, sexual aggression, and violence than in women who do not have a history of substance use disorders. So that's a unique situation. So turning to men, far more men outnumber women in those that seek treatment. That could be because there are other considerations for women that men don't necessarily have to consider. I want to make sure with these last little bit that we jump to this last slides. And again, I'm going to put these all on here, but I think it's important for you to know when we talk about LGBTQ issues and addiction treatment, I think it's important for you to know that, the stigmas for LGBTQ individuals still certainly do exist. It's your responsibility to be familiar with what is appropriate and that these terms are ever changing.